The latest COVID wave also affecting healthcare groups. It's all hands on deck as they redeploy manpower and pay staff extra to meet a spike in demand for medical care. Now, patient loads have surged by up to 50%. And as Sherlyn Seah finds out, keeping clinics well staffed requires meticulous planning and quick reactions.
Across Raffles Medical's hospital and its 35 clinics, patient loads are up by 30 to 50% this festive season. And despite planning staff rosters at least 6 months ahead, there are still sudden changes, especially with healthcare workers themselves falling ill too.
We do see a lot of movements and requests for staff coverage, especially these last few weeks where the COVID numbers are surging, almost like probably 3-4 times a week. Quite common. And some weeks was actually almost every day we can see it.
To ease the crunch, the clinics may draw on staff from other branches, the hospital, or even hire external short-term help. It's also made sure they get ample compensation.
Some of them may decide not to take extra pay, but rather to take it as a day off. We do recognize it too. And for those who cannot use up their leave for this year because of commitment to medical service, we do allow them to carry over to next year, like what we have done during the COVID period as well.
It's a similar approach taken by Fullerton Health. The chain of 30 clinics has had to call in extra manpower 3 to 4 times a week. And from lessons learned during the pandemic, it's now also planning its rosters a year in advance.
As far as possible, we have to let people have the adequate amount of leave, you see, because if we rush people back, actually that has a damaging effect on morale. And not to mention, practically, it will cause a further spread of various pathogens among the workplace also. And at the same time, we take adequate infection control measures among our staff to reduce infections among our staff as well.
That's to ensure its manpower remain as stable as possible, given the current COVID-19 wave.
I'll say it's slightly more challenging compared to previously, because the surge is really quite high now. The last time we had such a huge surge was the beginning of 2022, actually. But nevertheless, we have been trained already. We have been through one round of battle already. We have also employed a mix of telemedicine and live consults to ensure that we can maintain the service requirements for these patients.
Another group, Halfway Medical, is also using teleconsultations to meet the surge in demand. It says the move is to prevent overcrowding at its 50 clinics and better manage serious cases.